What are 7 myths about physical therapy? Working in this field, I run into different people or have conversations with people, and they sometimes assume something about the field that's not actually true. So in this video, I just wanted to address 7 common myths about physical therapy. The first myth is I need a referral to go to physical therapy. And this isn't true. You don't need to actually get a referral or a prescription or a script from your doctor ahead of time before you go to physical therapy. Back in 2015, this became legal for you to go directly to your physical therapist. Myth number 2 is that physical therapy is painful. A lot of times people have an impression that if I go to therapy, it's going to be really painful and they're going to hurt me and I'm going to leave feeling miserable. That's not the goal at all with physical therapy. A lot of times, physical therapists or physical therapist assistants want you leaving feeling better than when you came in. They want you to be able to move better. They want you to be able to do more things. They want you to have less pain, less symptoms, less swelling, whatever you're coming in for. They want you leaving better than when you came in. Myth number 3 is that physical therapy is only for injuries or accidents. A lot of times people don't know exactly what physical therapists do and they don't really fully understand the services we provide, and so sometimes they just think that we are rehabilitative specialists, that we just help people after an injury or an accident. And although this is something that we're capable of doing, we also can do so much more. There's a lot of different things we treat. We can treat neurological patients, so patients who've had strokes. We treat babies with like torticollis. We treat the elderly with like balance stuff. We can treat people with dizziness or vertigo. We can treat people before they have surgery. Sometimes people will just have pain in their shoulder with moving, and so we can rehabilitate and work with better ways to move and stretching out so they feel better and they might not even need surgery. There's a ton of different things that we can do in physical therapy. Myth number 4 is that any healthcare provider can provide physical therapy services, and this isn't true. There are actually only 2 people who can provide physical therapy services, and that is the physical therapist and physical therapist assistant. Now, there are other people in the healthcare field that help out with this process, like a physical therapy technician or aide, but they're technically not allowed to provide physical therapy services. And the unique thing is, physical therapy can offer a lot of different styles of treatment. So unlike just going to your personal trainer and getting some exercises, or going to your massage therapist and getting a massage, physical therapy encompasses a lot of things. They can prescribe exercises, they can provide stretching, they can provide manual therapy with their hands like soft tissue massage, they can do joint mobilizations, they can do modalities like hot packs, cold packs, ultrasound. They can do a ton of different things. So physical therapy encompasses a lot, but not everyone else can do what a physical therapy does. Only physical therapists can charge for physical therapist services. Myth number 5 is that physical therapy is not covered by your insurance. And this might be true for some insurances, but most insurances will pay for your physical therapy services or for a part of it. Sometimes patients have a copay, which they pay a portion each visit, like it might be $10 a visit or $40 a visit. And sometimes they have deductibles where once they reach a certain threshold with healthcare services, then their insurance will pay the rest. But regardless of the insurance plan you have, a lot of times insurance companies will pay for physical therapy or pay for a portion of it. And a way to find this out if your insurance covers your physical therapy is just to call your insurance company and ask them what are your benefits for physical therapy, and they will tell you. Myth number 6 is that surgery is your only option, and there actually are a lot of different options you can choose from, or like a handful of them. You can get surgery, you can get injections, you can take opioids like medication and stuff, or you can lean towards a more conservative measure, which is like where you'll find physical therapy or massage therapy or a chiropractor, something like that. So surgery is not your only option. There are a lot of other things, and physical therapy and those other services that I talked about lean more towards the holistic side, where it's like letting your body heal you. So when you stretch out, when you do exercise, when you massage your body, different things like that, those are all more natural ways of helping your body versus invasive ways like doing surgery or injections. Myth number 7 is that I can do physical therapy by myself. I don't need to go to a physical therapist. Physical therapists have a doctorate's degree, meaning they studied physical therapy and everything that goes into it, the human body, anatomy, the musculoskeletal system, the nervous system. They study everything about their profession for multiple years on end, and they learn a lot through that. They have a doctorate's degree. So when physical therapists or physical therapist assistants treat patients, there's a lot of background knowledge that they use to choose what the best intervention is. How should they perform this certain exercise? What would be the best thing to do for this specific patient? And you can't get that just by yourself by Googling something or by just reading an article in a newspaper. And also, like I said before, physical therapists use a lot of different ways to treat people, whether it's modalities or stretching or exercise or manual therapy. And if you're just doing it by yourself, a lot of times you can't do all the different services that a physical therapist can provide. Even though you might be able to do some exercises, like physical therapists actually want to teach you exercises that you can do at home so that you can work on these things at your own leisure. But to be able to do everything that a physical therapist can do, it's hard to do all of it on your own. Bam, that's 7 different myths in physical therapy, and I'll see you on another video. Peace.